Hi, I'm Bill Osmolsky with the MacIver Institute, and this is your MacIver News Bulletin. COVID positivity rates have never been lower in Wisconsin, at least not since Governor Evers declared a public health emergency 1 year ago. Right now, about 2% of tests come back positive, 2%. As for the number of actual new cases, we've dropped to less than 400 a day. It hasn't been that low since June. Despite these strong indications that COVID might finally be on the wane, Governor Tony Evers says, don't expect things to get back to normal anytime soon.
Right now, if we, as a state, received a massive increase in vaccinations, that number would be probably, or that date will be probably sometime this summer. That's not going to happen. And so, and in addition, in order for us to continue to be in this downward trajectory, we do need to make sure that people mask up when they're outside of their homes and stay safe. It's just basic mitigation prevention that we have to continue to do.
Despite talk of us approaching herd immunity, DHS says only those that have been vaccinated count towards herd immunity as far as the government's concerned.
We're not quite near herd immunity anywhere in the state yet. We're at about 14% of the state that has received the first dose, a little over 6% that have received both doses, and that would really be how we would measure herd immunity. And we need to get somewhere, Dr. Fauci says, between 70 and 90%.
And UW-Madison has become an Orwellian testing ground. Mandatory testing, mandatory phone apps, and soon mandatory vaccinations.
So that now we require that everyone has to test twice a week if you're an undergraduate student. We have an app called the Safer Badgers app. By the time I pull it up on here, everybody has it. You take your test and it shows up as a badge in this app, and the badge has to be green. If you are up to date on your testing and your tests were negative, you have to show a green badge to get into any building on campus. After we get all of our faculty and staff vaccinated, my next goal next fall is any student who arrives on campus who has not yet been vaccinated needs to get a vaccination from us. If we can do that, if we can vaccinate our community by the beginning of fall semester, we will have a reasonably normal fall semester. And that is what we are aiming for.
Meanwhile, lawmakers are beginning to work on the next state budget, which will go for the next 2 years. The total price tag for the current state budget is $84 billion. Governor Evers wants to spend $91 billion in the next budget. That's a $7 billion or 8.3% increase. During a recent forum, Democrat Senator Janet Bewley argued for more local funding. Even though locals have the ability to raise the funds themselves, her argument, voters don't know what's good for them, so the government needs to step in.
I have 4 towns in a county, the one right next to me, Ashland County, that has no ambulance service. Now, this isn't because they're lazy. It isn't because they spend their money in a bad way. They have no provider that is willing to come in because it's too expensive, too far. They have no volunteers. We are on all volunteer. No paid ambulance service will come in. So if you call 911, you cross your fingers. Right now, they drive themselves to the hospital, to the emergency room. It's a mandated service, and they can't do it. And they're heartsick, and they're begging for help.
Have they gone to referendum already and asked the voters to increase their own revenues?
They haven't had time yet, but they're thinking of it, yes.
Okay, so they have that option. That's good.
Pardon me?
They have that option now, right?
Yes, they do. And the voters will turn it down, and then they're going to be in the same position that they are right now.
So if the voters turn it down, doesn't that mean that they don't support what you're advocating for?
No, perhaps that means that they're not smart, you know? Sometimes we have to do things that allow them the ability, we as a state have to do things that are part of the state's responsibility that should not always be linked to one group.
The budget debate will go on for the next few months, and the new budget is scheduled to go into effect on July 1st. The MacIver Institute will cover all the developments and provide continual analysis. Be sure to visit us at MacIverInstitute.com and on Facebook, Twitter, and YouTube. For the MacIver Institute, I'm Bill Osmolsky, and this has been your MacIver News Bulletin.